The second big aim that we need to look for is how, in that, we protect the vulnerable and the elderly, who are at most risk of serious illness and dying from this. And the way this disease looks as though it appears is that you have 5 days or so of mild viral illness, and then a small proportion of people get a second phase where they have some sort of immune response to it, which causes the damage. And the elderly and the sick are much more likely to get that. So during the period of peak transmission, we need to protect them at that phase. And if you look at the curves, it becomes obvious that if you do that at the moment, you're not protecting anybody, really, because the number of cases are too small. If you do it at the right time, then you're protecting them over the peak, and you're not asking them to be in isolation for too long. Similarly, with the idea of households going into complete isolation, that comes a bit later, when you've got some more cases coming up. At the moment, if you asked households to completely isolate if one person was ill, most people would not have coronavirus. You may have to do the whole thing all over again. And what happens then is the effect of that wanes, because people get fed up with doing this and you end up with not being able to do it time and time again. So the timing is critical, and that's true across all of the interventions we've looked at. That's why this is a package of things that need to happen at the right time and in the right phasing. In terms of mass gatherings and schools, it's true that there's some effect in closing schools, but that effect is minimal, and actually you'd have to do it for 13 to 16 weeks or longer, and you don't need to be a very advanced mathematician to work out that the chances of keeping children not speaking to each other or playing with each other over 13 to 16 weeks is 0. And therefore you have to be very careful to make sure you take the right measures that will stop this, rather than things which might end up with children, for example, going to stay with grandparents at a time when they might be most vulnerable. So the idea is to do things at the right time, not to end up with measures stopping during the peak and exposing more people to illness. And I'll hand over to the Chief Medical Officer to explain in more detail the measures that are being proposed.
So I'll just amplify just a few of the points that have just been made. First of all, we are clearly now stopping the contain phase of this operation that we've always said from the beginning. There were 4 stages to this: contain, delay, research and mitigate, and the contain finishes from today. Fantastic work has been done by my colleagues in the NHS and in public health across all 4 nations, and as a result of that, finding the early cases as they were reported, isolating them with the consent of the people involved, for which we are very grateful, and following the chains of transmission, that has helped to slow down the seeding of this virus